All right,
Good
I already
evening.
introduced you. All right, so welcome, Mr. Soma. Welcome. Thank you for being with us tonight. Everybody was waiting. Everybody was here before 10 o'clock, but they waited. 200 of us here are excited to hear from you. So welcome and thank you for taking this invitation, Mr. Soma. So I'd like to give this time to you. Do some introduction, talk about the product, and later on, I'm gonna read some questions that you need to answer. So, Mr. Soma, welcome, and let's say hi to Mr. Soma.
Hi to everyone there. Good evening, Mr. Nathan. Good day to everyone from all around the world. I was told by Mr. Nathan that there are people from Europe, from the US, from the Philippines, and so many other countries. And first and foremost, my humble apologies because I couldn't come earlier because we had actually an appointment 2 weeks ago, which was arranged for today, 8 to 10, and I rushed from there. In fact, I excused myself and came off earlier than normal. Actually, we had a game, and they had just enough players so that everyone could play. And I just finished the game, rushed back, shower, and here I am. So I'm really my humble apologies for being a bit late. Let's get started from there, Mr. Nathan. Sorry for keeping everyone waiting. So where shall I start? To tell about the product?
Yes, I think,
Okay.
Mr. Soma, before you talk about the product, can you give us a little history about your journey here in Prife International, how you get to hold this product, who introduced
All
you,
right.
and why you fell in
Okay.
love with the product?
Okay, I think that'll be good because I mean you just don't simply fall in love with something because actually I was planning to retire and go around the country and some other countries as well, and that's what I promised my wife. And suddenly I fell into Prive, and I'm stuck there for the time being because of the passion. Now let me explain how I started with Prive and why I'm so passionate about it. Now, in 2019 December, I was actually forced by my family to arrange with the doctor to have a medical, test on me. All right. Before that, I have never gone for a medical test in my entire life. So that was the first time. And after the test, I was told by the doctor, you have high blood pressure and you also have a high sugar level. And it was like a shock to me because I was a little bit active at the time. And what I did was I asked the doctor, how long and he said, you have to take this medicine. And he gave 3 months supply for both. And what I did was I asked him, is there any alternative? He said, no, there's none. And he gave a snigger, a cynical smile, that nothing can be done. And at the same time, I asked him, how long do I have to take this, doctor? He said, forever, entire life. Okay, then I was thinking, what shall I do? So I told him, asked him, in fact, can I ask you for a little time to see if I can find some alternative? He said, by all means, how long would you want? And I told him 3 months, that should be fine for me. He said, take 6 months, it's all yours. And what I did was, the moment I came out, I just did one prayer. I didn't know what to do. Please, God, please let me find an alternative. And 1 week later, I'm meeting someone who's talking about this water, which is energized with a terahertz device. And at that time, it was something which is almost impossible for me. But the situation was such that I had no other choice because we have tried everything else, doctors have tried everything else, and this was something new. So what I did was I took the water back, and then I couldn't try for health because it will take a little bit longer, but I tried as an athlete. And what happened was, after that was something just mind blowing, because what happened was I was also giving courses. I was with the National Sports Council, giving courses for sports science, and many of the sports science principles had to be thrown out the window. It just changed. And I said, this is something different. I really have got to try this. And at that time, there was no device in where I come from, Malaysia, and they had to order it specifically from China. And when it came, immediately we got started. And my wife was having some back pains, and I just went on with it. 100% this water, charged water. And nearing 6 months, my wife reminded me, you remember you have to go for the test again. You have promised the doctor. And when I go and see him, I was shocked because I forgot that I needed to go and see him again, and I was eating as I liked. And when I went and did the test again, you know what he told me? Your sugar is normal, your pressure is normal. Wow. And then he tells me, your markers, prostate markers, a little bit high. I can recommend a specialist to you. So what I told him was, doctor, can you give me another 6 months to see what happens? He says, okay, it's all yours. So I go back after 7 months, January of 2021. I go back and do my test, and it's normal. So now my sugar is normal, my pressure is normal, and my prostate markers are normal. What more can you ask for? So then, just after that, this device came in, right? So Dr. Steven, Dr. Jimmy, and the group, the first time they brought the device, and I was one of the first who came and tested the device. So Mr. Shankar is a good friend of mine. So he called me, he said, can you please come down and check this out? See if it was, because he knows I know something about terahertz technology. Because at that time when the water was beginning to work, I began studying about the technology, about terahertz energy and what it does and what it cannot do, and whether it was safe and not safe. So when this device came, I had an upper hand. I was somewhat in front of everybody. All right. So when I tested the device and I saw the device, and then we tested there, because we know about what the water does, but we didn't know what it does on the body. But when we tested, it was just super. Within 20 minutes, 30 minutes, he's doing lots of things. So then you look at the science behind it, and you know that you're on to something very good, and it's definitely going to take the world by storm. It's going to explode. So what we said was, yes, we are in with you. And in April of 2021, we have our first device, and we are testing on lots of people. And we found that everyone we were testing with this device were definitely getting better in so many ways. And the company started on the 1st of June internationally. And after that, there's no looking back. And at that time, I was actually working with the government, but I was helping the private on the part time. So to bring this technology to the world, so I started talking for them, Zoom meetings, and we tried to bring everybody to the understanding that this is what it is, because we had people who were saying other things. We had where we went to India, there was an alternative doctor. He was telling, you blow on the head and it goes to the body. So similarly, lots of people were saying different things. So the intention at that time was so that everybody understands the technology as it is, nothing more, nothing less. And I think we have succeeded in that. Now almost everybody is talking the same thing, exactly what the technology is, and that is really super. And now, right now, we can see that it's helping lots and lots and lots of people. And if you understand the science behind that, you are definitely going to love it, and you are definitely going to start using it even more. And that's when we decided to, Shankar and myself, we knew about what the water does, because Mr. Shankar had colorectal cancer. The doctor, he had given him only 6 months to live. So he was trying all kinds of things. And when I suggested to him to use this water, initially he was a bit reluctant. But when he started using, it just turned him around. And today he's living more than 2 years beyond the 6 months. Right, Mr. Shankar? Right, his colorectal cancer is gone. And it was fourth stage. Right? So beyond, and after that, there was just no looking back. We just wanted to bring it to everybody, And we're just passionate because every time we're helping somebody, somebody gets better. It's so priceless. I mean, it makes you just happy. It's not because of the money, but it's because the blessings. And it's so lovely to see somebody who has been trying all kinds of things and not getting better, but now you can see them getting better. So that's where we are heading towards now.
Wow, thank
Yeah.
you for that, Mr. Soma. Thank you so much. Now, can I start with the questions?
Yeah, sure. Go
All
ahead.
right, we've got a lot of questions, and let me just choose now. I know this is something very, very simple, but there
Just
is,
shoot.
yeah, I should this. There is in our presentation that says that there are over 100 minerals in our crystal tube, right? And so, would you like to explain about these minerals, or what are these
Okay.
minerals?
Now, basically, what's happening is let's not talk about minerals because let's not get confused with the minerals which we normally see. The normal minerals which you are seeing, they work in different ways. And then for body, we need lots of trace minerals. But here, when we are talking about minerals, we are talking about minerals which can, what shall we say, produce terahertz energy. So what's happening is when you see inside the device, the front half of it contains a sheet which is the quartz crystal, and this quartz crystal contains these minerals which contain this terahertz energy. So what's happening is when you blow, the air is blowing through, is bringing out this terahertz energy and then shooting on to wherever you're pointing and is penetrating wherever you're pointing to. So that is the beauty of this device because it is natural from natural minerals. There are also other technologies. When you talk about terahertz energy, there is no one way of producing terahertz energy. You can use water, you can produce it from water, you can produce it from chips, you can produce in many ways. But what this device does is getting it from natural minerals which are producing terahertz energy. You can't get better than that.
Wow, that's amazing. So our terahertz, they are produced from natural minerals that are found there in the tube. Am I correct, Mr. Soma?
That's what I'm saying. Yes.
Yes, that is so great. That is so great. Others are produced in different ways. Ours is natural.
Yes.
That's why we don't have any contra side effect or
Exactly.
contraindication. All right.
Yes.
Now, I'm going to read another one. This is from Wally, and I tried to answer this a while ago, but he said, he has a prostate issue. Okay.
All right.
He went to bathroom 2 hours at night and using the one for over a week already, and he hasn't noticed any improvement or changes of his issues. He drank so much charged water, blowing 2 to 3 times in a day, but still no changes. I even bought a dryer stand so I can stay under the one. So what's going on with this man, Mr. Soma?
No, probably what he's doing is he's shooting everywhere except at the correct place. Now, if you want a specific organ to get better, then you have to focus on that area. Now, what he's doing is when he's drinking this charged water, is definitely helping him. But what's helping him is throughout the body, everywhere, everything gets the benefit. But he wants to focus on the prostrate. Now, if you want to focus on the prostrate, you are going to point it from below, all right, in between your thighs there, from below directly into where the prostate is. That's the best area where you blow for prostate, and you should do it at least 20 minutes each time. You see, what's happening is some people do not go up to 20 minutes. They go up to maybe 5 minutes. They go up to maybe 10 minutes. They don't go the whole distance. And when they don't go the whole distance, what's happening is it doesn't work, right? So you don't see the benefits enough. So you have to go the whole distance, minimum of about 20 minutes each time between the legs, between the thighs, pointing upwards. Then you should be seeing some better results.
Wow, that's a good tip.
Yeah,
Blow a minimum of 20 minutes per area. Don't go moving around anywhere, correct?
correct. You are right.
That's a good tip right there. That's a really good tip right there. Wow. Well, thank you for that. There's another question right
Yeah.
here. Okay, I would appreciate if you can mute, guys. Now, this guy has he just received his IteraCare, and we're talking about blowing on the spine, but he got a gallbladder catheter draining the inflammatory cells. So what should he do?
Okay, now what exactly is his issue in the first place? What is his problem?
He
Why
has
is he
a
blowing on the spine?
he has a gallbladder catheter, so I think he
Yes.
has some issues with the. Well, I'm gonna read it. Can't ways to use it. I was told just to do a spinal blow because I still got a gallbladder catheter draining the inflammatory cells. So he has a catheter, and he was told to just blow it on the spine, not to
All right.
blow it directly to the catheter. Correct?
Now, what exactly is his problem? I mean, of course, he's blowing on the spine, and then you have this thing draining from the gallbladder. But what is his actual health issue?
All
Why
right.
is he having inflammation?
All right.
We need to know that. Once we know that, then we can advise him correctly. That will be good.
All right.
Because right now, we will be telling him things which may not be right.
All right. Wizald, that was you who answered. His name is Wizald. What is your issue? So we can help you and to be more specific, okay? If you can type that down. Gallbladder is inflamed. His
Okay,
gallbladder
fine.
is inflamed. Okay.
All right. So the problem is at the gallbladder. So this device is very well suited to bring down inflammation and pain management. Right? If you look at the statistics, it's 5 star. Right, for pain management and also for inflammation. So I would definitely suggest blowing directly onto the gallbladder. Why blow on the spine? So when you're blowing on the spine, you're looking at other issues, you're looking at other problems, right? So he should be blowing directly onto the gallbladder. So that will be good for him. And he will see that the
Mm,
thing is coming down fast and the recovery is much faster.
correct, correct. Well, thank you
All
for
right.
that. Thank you for that,
Uh,
Dr. Soma. Now, another question. What is the best way to help get rid of psoriasis? Especially it's already flared up. And the affected areas, can it be wanded directly or where to wand? That's the question.
okay, now if let's say you have a light bulb at home, all right, your light, and the problem is at the switch. Now, changing the light bulb is not going to get the light back to you. It's not going to switch
Mm,
on. You have to go to the source where the problem is. Now, when you look at psoriasis, when you look at eczema, if you study the underlying problems, for me, yeah, my perspective, okay. Now, why it happens is sometimes people don't understand that the water plays a very big part. Water
mm,
plays a very big part. There are basically 5 ways in which the body tries to tell you that it is lacking in water. First of all, what do you call it? You have to take out your toxins through urine. Now, if you can't do that, then it is come out through sweat. If you cannot do that, then you have to come out through passing motion. If you cannot do that, then it'll come out, it'll show in the form of rashes. Now, if you can't do that even, then you start having balls. And we don't have the balls, then it starts becoming psoriasis, eczema, because the body is trying to clear the toxins and is unable to do that. Now, basically, what's happening is they need that water to take out all the toxins and the waste in the body. And what he should be doing is number one, drinking this charged water by a big volume beyond 3 liters. Now, what's happening is when you drink the water, they need to understand that when you how the body uses the water. Now, first of all, it uses for urination about a liter to a liter and a half, sweating about 500 milliliters, and then what do you call it? Passing motion about 300 milliliters, and breathing probably about 200 milliliters. So in total, women need about 1.5 to 2 liters. Men need about 2 to 2.5 liters just for their basic utilities, right? To do the basic things, and you need water beyond that uh, to clear and help with other aspects of the body, all right? And if let's say you do not drink much, now what's happening is the body when the water level is very low, the amount of water you drink is not much. First, it goes to the brains, all right? It prioritizes the brain. Now, after that, what it does is it goes to the organs. It prioritizes the organs after the brain. Now, and then if there's extra water, then it goes to the limbs. Now, if there is not enough water, it takes water and uses it for the brains and for the organs. Your limbs do not get the water, and eventually you're going to start with psoriasis and eczema because it cannot clear the toxins from those areas. So what he needs to do first of all is drink lots of water, and water meaning here, if you drink this charged water by these devices, our devices, is definitely going to help you. Why? Because by research, the normal water which we are drinking, all right, the rest just comes to the tummy and then it's just gone because the water is in the form of clusters, the water which comes to us. So if you drink 1 liter, you're only getting 500 ml. If you drink 2 liters, you're only getting 1 liter. Most people drink only anywhere between 1 to 2 liters, not beyond that. So they're definitely going on dehydration. So the body is always lacking that water and things flare up. So when they increase this water, they drink beyond. I forgot to inform just now. When you charge the water and you drink that water, more than 90% of the water now enters your cells and starts cleaning, clears your toxins, clears your waste. So there's no place for psoriasis and eczema to remain.
Wow,
Right?
that is great. Wow. So for skin problem, drink
Drink
a lot of
and
water.
blow and
Drink
blow,
and blow. Okay,
and
drink
the thing
and
will
blow.
clear up very fast.
Wow, wow. So
Yeah.
here, Mr. Soma, if you drink the terahertz water without blowing, will it be affected some health problems like high blood sugar level, high blood pressure? Blowing
Say
takes so
again.
much time. If you drink only the terahertz water without blowing, will it be
Okay.
affecting other health problems like high blood or sugar? Blowing takes so much time and effort for a lazy person like me.
That's a good one.
Yeah.
Let's look at it this way. We have an advantage because there are devices which just charge the water, and just by charging the water and drinking it, already it is healing lots of people. Trust me,
Wow.
I know about it. All right, but what's happening is you have an advantage. You're working from the inside and you're working from the outside with the blower. You're focusing on areas where you need speedy recovery. So why be lazy about it? The water is definitely going to help, trust me, but it doesn't know where the main areas where you need the help most. It goes to the entire body. It helps the entire body, but it takes time. It takes longer. But when you start blowing with the blower, it focuses on areas where you need quick help and you recover much faster. You see recovery faster.
Wow. Great. Okay. Wow. I'm going to move forward.
Yes, sure.
I've been suffering anxiety and depression. I can't sleep. What should I do to avoid this? Where to blow? Very common question.
All right. Normally, people with anxiety, depression, is a lot with the mind. All right. They're thinking
Mm,
too much, or they're in areas where the frequency is disturbing them a lot. All right. Now, basically, when you talk about sleep, you have to also understand that the frequency for sleep is different. All right. You have alpha, beta, gamma, theta, those frequencies. And the frequency for good sleep is anywhere from about 3 to about 13 hertz. All right. And when you blow, this frequency, this terahertz frequency is around 7.6, 7.8. So it's right in the center. So what you do is you start blowing on your head for a minimum of 20 minutes, and it brings that frequency to that range, and you find that you can sleep better. And at the same time, that it is for some people it brings them to sleep, but for some people it activates them. So you have to test. If you find that you are the person who gets activated, don't blow beyond 6 p.m., 7 p.m., and then you are fine. But if you are the kind of person who this can put you to sleep. Then blow just before sleep, and you're definitely sleeping. You see many people, when you blow on the head or just around the head, they're already going to sleep. They're already drowsy because it is
Wow.
setting the frequency at that level.
Wow, that is great. Wow.
Yeah.
What would you recommend for severe wet maculative degeneration? What is this? Severe wet maculative degeneration.
Can I,
Wet.
without looking at the words, can I assume that it's to do with the eyes?
Oh, is it the eyes? Is it
Eyes?
Barb Smith? Barb Smith, is it something to do with the eyes? Because I don't even know this. Severe wet
That means, yes, eyes, and lots of water is coming out most of the time. Am I
Oh,
right?
I think so. So you just give a chat there. Yes, she said yes.
All
Eyes.
right.
Yes, the eyes.
Okay, something there is not functioning. Something is not functioning well, where the balance is not there, where the water is being produced, a lot of water is being released, right? So by blowing there, it'll bring it back to what it should be. So it should cut down. And there are people, what do you call that, dry forms, correct? Because there are some of them, when you start blowing, the eyes become dry, and then you find that you have to put in some fluids or something to wet it again. Now, these are normally the healing reactions. When he's recovering, it dries a little bit. People have gone through that, and after some time, it becomes normal.
Wow, that
So
is
just
great.
keep blowing, and it should clear up.
Wow. Okay. Now, Mr. Soma, I have a question.
Just on that note, before we go on,
Okay.
just to remind Bob Smith that just be careful of the heat. You do not want to fry your eyeballs. So just keep the heat a little bit away, where you just want the terahertz energy to get inside, and not too much of the heat.
Wow. Yeah,
All right.
that's great. Not too much of the heat. Don't fry your eyeballs. Okay. Yeah. Now, there's another one. This is about a dog, Mr.
All right.
Soma, about a dog. My friend's dog has a tumor on his spine. Should she blow her dog's tumor for 20 minutes?
Yes, that should be
Yes.
the protocol. You
Mm.
see, people ask why 20 minutes. I'll explain why 20 minutes. Uh, let's assume that we are going to make some coffee, right? So you need about maybe 10 minutes to get the water to the boil, and then you mix that coffee, and the coffee is lovely. But let's say in 5 minutes you take the water out, the pot out, and then you mix the coffee. Now, what's the coffee going to taste like? It's not ready for the coffee, correct? Now, similarly, when you are blowing, the terahertz waves need to get into your body. They need to do something there. They energize, they break the clusters, then they need to get it into the cells, and then the cells need to be activated. The cells need to do what they're supposed to do, get rid of whatever is there. Takes about anywhere from 15 to 20 minutes. So
Mm.
we used to say 15 minutes, but now I always say 20 minutes, because when you say 15, they do 10. So when you say 20, they do at least 15. And it gets it. So now everybody is saying 20, which is good.
Wow, that's a great note. I learned a lot, Mr. Soma. 20 minutes minimum, guys. 20
Yes,
minutes.
do
Wow.
20 minutes.
Yes, that's
And
correct.
you should
That's
be
correct.
seeing things happening. Now, there are people, 20 minutes, they glow the whole body, and they tell you, I don't see anything happening. Definitely, you're not going to see anything.
Yeah, correct, correct,
Focus on
correct.
certain areas, one area for about 20,
Yes.
and you will see
Focus.
results.
Focus on one area for minimum 20 minutes, guys. That's a good tip right there. All right.
Yeah.
He has removed one half thyroid, right? One half is there, but not working. Can the thyroid be revived? I'm on thyroid medication. So what to do? This is from Rhonda.
Now, people having thyroid problem have recovered very well, but having have removed one half and not knowing what is happening to the other half, it's like this. If you have a plant, a pot of plant, and then you find that it's slowly dying, but at the same time, if there is life to the plant, it's definitely going to, you can make it recover. you can revive it. But if it is dead completely, then you cannot do anything with it. So the
Mm.
thyroid there, if it is still, I mean, the cells there are still alive, then something can be done. All right.
Mm.
So
Mm.
otherwise, yes. So just focus on them. Just keep blowing, and even that part should be coming down, becoming better.
Wow. Okay. A very simple
Yeah.
question, Dr. Soma. For a diabetic, what's the best thing to do with Itera for diabetics?
Now, first of all, we understand that diabetes is to do with sugar. Now, some people, what they do is they blow at the same time they're consuming sugar on this side.
Mm.
So you should stop that first. Stop all sugar. And there are also some people who fast, right? Even fast 16 to 18 hours in a day because that completely removes the sugar in the body. Now, at the same time, when you start using this device, now the first thing is focus on your pancreas, right? Now, what's happening is uh, I'll just explain. I mean, no offense meant to any doctors here, but this is what's happening. Now, most people who have diabetes are on pills. Now, what's happening is they get these insulin pills, and as time goes by, it slowly increases. The medication increases, right? And then eventually you have this jab here, which is on a higher
Mm.
note.
Mm.
Now, what's happening is when you ask them, "Oh, I'm good. My reading is good, and I'm okay. My reading is good," but they do not realize that actually their pancreas are getting worse. The problem is not the insulin; it is the pancreas. Now, if you have a way to revive the pancreas, then you do not need as much insulin. It will not go up. You can stop it there and slowly bring it down. And as of now, there is no other way to bring or revive the pancreas. But what's happening is for many people, when they start blowing on the pancreas, now the pancreas start getting revived, right? So when they start getting revived, they start producing insulin as well. And when they start producing insulin, now you're also taking insulin from the outside, artificial insulin, and then now your body is starting to produce. So the fear is you may go hypo. All right. So when you're blowing, make sure you do not go hypo. Keep some sweets with you if you're feeling a bit dizzy, because it will definitely go down. And as it goes down, your medicine should be going down as well. So what you need to do is when you find that this thing is happening, you need to go and consult the doctors, get your reading done, and the doctor will adjust your medication on a downwards trend. All right?
Mm.
Yeah. And at the same time, besides the blowing on the pancreas, you need to drink lots of this charged water, ideally beyond 3 liters, and it's
Wow.
definitely going to help you.
Beyond 3 liters. You heard
That'll be
that.
good
That's a great tip.
because 2 to 2.5 liters is going to be used by your utilities, and you
Mm.
need more than that to work on other parts.
Wow.
Yeah.
Wow. Thank you. Thank you. Wow. Now, there's a good question here. How to treat endometriosis and fertility? Currently, she's doing cocoon technology. Can she replace the cocoon therapy with IteraCare therapy to address endometriosis and fertility? Wow, this is
Now,
fertility. Oh.
wow. Now, basically, you have to, I mean, go to the source where the problem is.
Mm.
You're talking about fertility. Now, fertility, it depends on two people, not just one. Sometimes you're treating the woman, but then it could be a problem with the man. All right.
Mm.
So we do not know as of now what exactly is the problem. Now, another thing is when it comes to women, what happens is they have this fallopian tube, and this fallopian tube at the end where the eggs come out, sometimes it is blocked by fat. All right, fat blocks it, and the eggs cannot come out.
Mm.
So, especially those women who have some additional fat in the body, all right, you find that this fatty tissue is blocking it. So we do not know what exactly is the problem. If we know exactly what is the problem, then we can give the what do you call that, correct. I mean, help out correctly. Now, another aspect is for the women. You find that the womb, all right, the womb, many women presently are having ulcers, having fibroids, all right, because the
Mm,
lifestyle now, and then the food which they are taking, and then the general cleanliness, right? All this plays a part. So what happens is when these things gather inside the womb, on the walls of the womb, then for women normally they show symptoms are leukorrhea, which is a white discharge, and then even blood. It is relate. Sometimes it comes out in chunks, and then sometimes it comes out cheesy. Sometimes it comes out smelly. You have some bacterial infection as well. So if you have these things, then you have an indication of what's happening inside the womb. So as of now, we do not know what exactly is the problem. But blowing this, you see, basically why these things happens is the supply of blood to these areas may not be good. They are not as
mm,
effective or as good as they should be. Because if they could remove whatever is there, then these things wouldn't happen. So by blowing on the womb and around the womb, it improves the blood flow, brings in more oxygen, nutrients, takes out more toxins and waste, and things should improve. And many women find that even with fibroids, it's coming down. It stops it there
mm.
and brings it down because now it's able to do something there.
Wow, that is great. Wow. Wow, wonderful. All right. Dr. Soma, it says Parkinson's.
Call me Soma.
Yeah, Mr. Soma, Soma,
Yeah.
Parkinson's. Any advice for
Parkinson.
Parkinson's? Yeah, Parkinson's.
One thing I can tell you is that my father had Parkinson's, but at that point of time, we didn't have this device. Otherwise, could have
Mm,
helped him a lot. Now, what we are seeing is those people with Parkinson's, the trembling, the shivers, the
mm.
uncontrolled action is really coming down for lots of people. They have more control over things. The shivers, the trembling is coming down. Those people who had problems walking, lifting the foot and putting it forward so that they can move. Those people with Parkinson will have that problem. You definitely need assistance. But now we are finding that those people with Parkinson's, they can move on their own without much assistance. So it's definitely helping them.
Wow.
Yeah.
Again, 20 minutes minimum, right?
Yes.
Okay. Now we have colon and rectal cancer. Any suggestion for cancer in the colon and rectal
Okay.
cancer?
Now, as I said just now, my friend Shankar, close friend, good friend, he was diagnosed with colorectal cancer, colon, rectum, colorectal cancer. All right,
Mm,
so just away from the rectum. Now, if you look at the pictures, what you will see is lots of bubble-like, what do you call that, the tissues like bubble around, all growing there and closing the passage. So what will happen normally is for these people, they have problems going passing motion, and most of them they wouldn't want to go leave the house because it comes out little by little, each time a little bit, each time a little bit, right? So it's a real problem for them. And as I said, my friend, he had to go almost 30 times in one day, and then with some Ayurvedic medicine, he brought it down to around 16, 17. But still, it was bad. He hardly left the house because he didn't know when he was going to the toilet next. Now, what happened was when he started using this water, charged water, at that time we didn't even have the device. Now, with the device, it's going to help much more. The bubbles started breaking, and then the the rectal area became clear. At that time, the doctors gave him 6 months. That's all. He said, we cannot
wow.
help you. And today he's still living more than 2 years.
Yeah, I
And it's
met
clear,
him. Yeah, I
right?
met
You
him
met him.
personally. Yes.
Yes.
Wow. All
So
right.
it is
There.
definitely helping.
Wow.
Drink the water and blow.
Drink the water and blow for
Blow.
colorectal
Keep
cancer.
blowing. It will definitely
Yes.
clear up.
Yes. Does terahertz destroy parasites and viruses?
Okay, that's a good question. Bacteria, definitely. You see, basically, it's like this. Now, the body has its own immune system. Okay, they are designed to attack whatever comes from outside. All right. The problem with people is the immune system goes low. So now the defenses go low. So the viruses, parasites take advantage. All
Mm,
right. So you have to boost your immune system. That's the first thing. Now the second thing is the environment. The environment, most of these viruses, even bacteria, we have good bacteria, bad bacteria, parasites, they love the anaerobic environment in the body. All right, they thrive in an anaerobic environment. So when you do not give the body good, I mean enough oxygen, all right, what happens is it becomes anaerobic. So they thrive. Now when you start giving lots of oxygen in those areas, they do not survive. They cannot
mm,
survive. All right. So they die. So what happens is by blowing this, the clusters, all right, they break them up. The cells get fed with the water, hydrated, and then they charge, they start working, and then the environment begins to change. Now, just
mm,
on that note, areas where you find disease, you find that there is less water. Looking at it another way, areas where there is less water, you find disease. So the
mm.
only way is get that water into those areas, and the disease is gone.
Wow. Get those water in those areas and the disease is gone. Wow. All right. This is a very interesting question, Mr. Soma.
Yeah.
What is the best way to explain? Because for other people, IteraCare has a very fast effect. For others, it would take a while. So what's the best way to, to explain?
No two people are the same. You
Mm,
might have diabetes, I might have diabetes, but you may be more chronic than me. So it may take a while longer for your diabetes to be cleared compared to me. So similarly, also the other problems, no two people are the same. It differs in the degree of how chronic it is. So it might take a longer while. And then at the same time, there are some people, they just don't have one problem, they have multiple problems. So the
mm,
body has a problem, which shall I heal? I wouldn't want to use the word heal or cure. Which one shall I recover first?
mm,
So when you drink the water, it goes all over wherever it is needed. So it takes a little bit longer. For a person who has only one problem, you might find that he's focused on that area and is healing faster.
mm.
Yeah.
Correct, correct. Blood clots.
Mm.
Can it dissolve blood clots, the IteraCare?
Now, in the first place, why does the blood clot happen?
Mm,
Okay, so when you say a clot, there are always some clots. You see now the water, whichever we are drinking now, it is in cluster form. You find that the water, the plasma in the blood, and the whatever is there, they are all clumped up in a way. So they have problems moving, and that increases the viscosity of the blood. Now, if your blood vessels are elastic, dilated properly, then even the small clots are not going to cause you a problem because they can pass through.
mm.
The problem is because they're constricted, they're hardened, they have problems passing through, and that becomes a problem.
Wow, that is great. Wow. Another question, Mr. Soma, what's the proper way to blow for person suffering thoracic aneurysm? Thoracic aneurysm.
Now, can you explain a little bit more about it? I think
Thoracic,
it's to do with the head.
yeah, with the head, aneurysm. Yeah.
And he has got pain there.
Yeah,
Now,
suffering and pain.
yes.
Yes. Yes.
So most likely these areas, I'm quite sure that this person is definitely not drinking much water, right? So what do you call that? Most likely the vessels there are a little bit constricted, a little bit hardened, so they have problem passing through, and that gives the pain. All right. So when he keeps blowing, so it will make the thing more elastic because now the cells can function better.
Mm,
And uh, imagine like this: you have a tube, all right, watering tube, all right. Initially, it's soft and easy to use. After some time, it gets hardened, and you just can't use it as well. All right, you have run into problems. All right. So similarly, vessels there, they when the cells are not functioning enough, the water is not getting into them, they become hardened and constricted, creating all kinds of problems. All right. So when
Mm.
you reverse that problem, then the thing is gone.
Wow, that's great.
Yes.
Mr. Soma, after bypass, where to blow to recover quickly? Heart
Bypass.
yeah, bypass.
Now, it is a little bit different from having stents, right? Normally, people with stents, we tell them uh, try to avoid blowing in those areas because we do not know what their stents are made of. So we tell them to avoid. But when it comes to the bypass, it is using parts of their body where they do the bypass. So it's still almost natural. All right.
Mm,
So by blowing on those in those areas, it's definitely going to improve and not make it worse.
so it's
You
okay.
understand the difference?
Yes, yes.
Yeah,
Wow,
it's not like
wow.
stents.
So
So people
bypass.
worry, okay, bypass stents. They look at it similarly, but actually they're two
Mm,
different things.
stents
Stent avoid. You know why?
avoid.
Because we do not know what the stent is made of
Mm,
and what the heat or the blowing can do to it. And if anything goes wrong, then you are the first person they're going to blame. But if it
correct.
gets better, they will say that it's something which they did. So we avoid that.
Yeah, yeah. People are like that. All right.
Yeah.
This is from May M. His son is diagnosed with autism spectrum disorder. He's 6 years old. And so what's your advice? Where to want him?
What was that again?
His son is diagnosed with
Autism. All right.
autism spectrum disorder. Autism
Okay.
spectrum disorder. 6 years old. So
All
what's
right.
your advice?
Now, there have been some successes with autism. You must understand that when they are born, autistic people are wired differently from normal people, right? And
Mm,
people expect them to be rewired to be normal, which is almost impossible because they have been wired differently. Okay, that's the first aspect of it. The second aspect is when it comes to their physical body, anything to do with that definitely is going to help. But when he looks at the wiring, autism, then it's
mm,
going to be difficult. What you
mm,
can do is you can calm them down. People who where you had problems calming them down, autistic people can be very difficult. You can calm them down. Those kind of things. And then at the same time, I would also like to add a note here. Now, when you look at these autistic people, they live in a world which is comfortable for them. What we are trying to do is bring them to our world, which is so much different for them. And
mm,
make, because for us it is normal, for them it is abnormal. They have their own world, right? Lots of people who have been the most geniuses in the world were autistic. I wouldn't be surprised if Albert Einstein was autistic, Sebastian Bach was autistic, some writers, good writers, were autistic because they are just geniuses, just I mean, the way beyond us in those areas of their choosing. All right. So what we are trying to do is we are trying to bring them into our world where how we are wired. All right. So we have to look at that aspect. But at the same time, if you are talking about a health problem, about calming them down, toning down whatever is happening, yes, go ahead.
wow, that is
Don't
great.
try. You're not going to change them to our world because they are wired differently.
That's
Please.
right. That's
Yeah.
right. All right.
Yeah.
Mr. Soma,
Yeah.
they are drinking prescription medicine. Is it okay to drink with charged water, or it's gonna be
Now,
better? Mm,
I would say they're definitely going to get better. You know
mm,
why? Now, when you are taking prescription medicine, especially those people who are taking lots of medicine, what do you call that? They are in their component form, different forms. Now, when they are dehydrated or the water does not get in, it sort of dries up. They come together as compounds, and when they become compounds, what happens is they can act differently. Whether it's positive or negative. If it's negative, then you had it. All right. So the water plays an important part where the medicine works in the body. All right.
Wow.
And the charged water keeps it at that. And drinking
Wow.
more charged water keeps it better at that and brings it into the cells to work for them better.
Wow. Wow. It's gonna work better.
Yeah.
Another question. What is the best time of blowing? Is there a best time? 6 o'clock, 12 noon, 6 p.m.? Is there a best time to blow? What's your advice for people asking this question?
The best time to blow is when you're comfortable and you have time. Like if you're
Whoa.
rushing to work, don't blow because you're going to rush through, your cells, your muscles are not ready. When you come
Mm,
back, you have a shower, you've had your food, let's say you take a rest, you're comfortable, you're relaxed, you blow. It receives better. All right? Love
mm.
your body, love your blowing. It works better.
Wow,
Have
I
time for
love
your
that.
body.
Wow, I love that. Love
So
your body.
there's no time, but you need to give time to your body. We are looking at everything else outside except our body. And at the end of the day, the body is what carries you. And you do not have time for your body.
Mm.
So find time for your body, relax, take time, blow, tell yourself, I'm going to heal. Whatever is inside me is going to disappear. You have time to tell your body, and trust me, it works.
Wow. Love your body. Give it time. Yes. Don't be on a rush, guys. You heard that. Don't be on a rush. You gotta be
Doesn't matter whichever
comfortable.
time of the day.
Yeah, whichever time of the day. Now,
Arrange where you have time for yourself.
that's right. That's right. Wow. Mr. Soma, we have a lot of questions. I think
Yeah,
what I would suggest is I'm gonna copy paste this and I'm gonna answer most of them that I could.
no worries.
The rest that I couldn't answer, I'm gonna get back to you. Is it okay?
Sure, no problem.
And then we're gonna send this to them. Probably we're gonna post this in the terahertz page. Okay, is
All
it
right, no
okay?
problem, no
All right,
problem.
all right. Because a lot of
We
your
are
questions got
we are
sorry.
here to help everybody.
Mm. All right,
That's a passion.
that's right. That's the passion right there. Fractured bones. Why is it not allowed to blow on fractured bones?
Okay, now you see most of the fractured bones, they have metals inserted which are holding them together. They have
Mm.
screws which are holding them together, right? Now, as you know, metal expands, all right? So now instead of you joining that fracture, when it expands, it's going to pull it apart. So the problem here is
Mm.
the person is using it on that point. If he does not know how much to blow and how much heat to give, then he's going to create a problem. So to avoid that, what we say is avoid fractures, especially when it has metal plates.
Mm.
Otherwise,
Wow.
they are good. Otherwise, under normal circumstances, without any plates, just a fracture, they're going to help with the healing, speed
Wow.
up the healing.
That's right. Wow.
Yeah.
Is IteraCare safe for everyone who has transplanted organs? Example,
Now,
liver transplant, kidney transplant. Is it okay to blow it there directly?
the issue here is not about the terahertz or IteraCare. The issue here is about their body accepting the transplant. Now, if the body accepts the transplant and looks at it as one of theirs, then there shouldn't be an issue. But if it rejects, then you are going to have a problem. However much you blow, it is rejecting.
Mm. All right. Just like open heart surgery. Is it
Yes.
okay? Is it okay for
Uh,
open heart surgery?
you mean after open heart surgery?
Yes, after,
Yeah.
after.
After open heart surgery is still your heart. If it's your heart, no problem. And if the heart which you have transplanted, if your body has accepted it, shouldn't be a problem. But if it has rejected it or is not accepting, then you have a problem.
Wow. We've got questions here, a lot of questions. So again, guys, just to let you know, we're gonna copy paste all these questions. We're gonna try to answer all of them. I'm gonna answer them. My wife will answer them, but those questions that we cannot answer, I'm gonna pass it back to the Mr. Soma, and we're gonna post this so that all of you can we'll have the answers of your question. All of you will be served. We want you all to be served. Now, 207 of us tonight, 207 who are very excited. They're still here. They're very excited. All right. So where will it be posted? It will be posted in the my wife will send the link of the Facebook page. It will be posted there. All your questions. We're gonna try to, but give us some time, okay? Because we'll be flying. We have some things to do. But again, I'm gonna work with Mr. Soma with all the questions. So far, I know you're all enjoying, guys. Are you enjoying this? Wave your hands if you're enjoying it. Even Gatdula is really enjoying. Susan is giving a heart icon. Mom Hildy is really enjoying. Everybody's enjoying this. This is really amazing. This is really amazing. All right. Now, here we go. Okay.
I saw one with cancer just now.
Sorry?
There was one posting regarding cancer.
Cancer.
IteraCare and cancer. Did you see that?
No. Would you like to read that, Mr. Soma?
Just before this, just I think 2 messages before. How I'm not so sure. I can't remember the entire question. But how does IteraCare help with cancer? I think something like that.
Yeah. Can you?
Shall we have a take on that?
Yes. How can it help cancer? Yes.
Okay. Now, for people who have cancer, you do not worry about where the cancer is. You understand the concept behind cancer. Now, what is cancer? Cancer comes to people where something is not right in those areas. And most often, you lack oxygen in those areas, and the cells find themselves dying. Right? The energy at that area is low. So the cells find themselves as dying and they start multiplying. In most cases, of course, there could be other cases as well, but in most cases, this could be the case. So when you start giving back the energy to those areas and the oxygen starts coming back to those areas, the nutrients start coming back to those areas, the and when they find themselves they are living, then cancer cannot proliferate. Right? It stops and eventually it becomes benign.
Wow.
Right?
Correct.
Because you are now addressing the problem.
Mm.
So don't worry about where it is, but address the problem.
Correct. Wow.
Right.
That is great. Mr. Soma,
Yeah.
age a child, is it okay for what age for a child to start using the IteraCare?
Basically, you see, when you, even as a baby, infants, you can use them, but then you must have a little bit of caution here because there is heat coming out, right? This heat, we do not want the child to be burnt. As we say, you don't want to fry the wherever you're blowing, right? So be caution, have some caution with the heat, but blowing is not going to damage anything. It's just going to improve things, right? Wherever it's blown. And if you're using for an infant, that means that infant is having a problem, and that is why you want to address the problem. But if you look at it in another way, you might just want to give the charged water, and those people with charged water, they're definitely you can find the children are healthier, right? And you find that even children for that matter, if you improve their immune system, you blow where the immune system can get a boost, you find that they hardly get sick, they hardly have fever, and they hardly go to the doctor, and the doctors are going to come after you, right? No business.
That is great. Okay.
Yeah.
Few more, Mr. Soma. There's a
Yeah,
12-year-old boy having a small water in his head, hydrocephalus. Can I recommend IteraCare? Because this boy is having a lot of imbalances while walking and he's so pity. What can you recommend? That's Lito.
Hydrocephalus is basically where the brain or the head, the brain contains lots of water.
Yes.
In that area, right? Again, it could be something which is not functioning well, but then again, please refer to a doctor first. Have get to know what exactly is the problem. If it is to do with vessels which are not functioning and the water is being released, let's look at it this way, all right? With people with kidney problems, all right? They have a water retention problem. you'll find that the legs become bloated, there's water retention. Now, one of the reasons is because those cells there are not functioning well. They are not able to clear the water. But when they start drinking the charged water and blowing in those areas, the cells start functioning. They're able to remove that water. Right? So
Mm.
similarly, in those areas in the head, there could be a problem where it is not able to remove the water there, right? So if that is the case, then if the cells come back to what they are, then they start being able to remove that water and the problem comes down.
Wow. Wow. Is it possible to use IteraCare during and after chemo treatment?
You should.
You should. Wow. That's the
You know
answer
why?
there. Mm.
You know why? People who use the IteraCare before and they go for chemo and they come back, they're finding that they are not as tired as they normally are. Those who go for chemo, when they come back, they're so dead tired. They just want to lie down.
Mm.
And you find that they still have the energy. The second thing is lots of them lose lots of hair, right? And you find that those people using this care and also going for chemo, they don't lose as much and it recovers fast, right?
Wow.
It regenerates the body faster.
Wow.
Yeah.
Can this be used for cystic fibrosis on a 3-month-old baby?
Again, there could be something there the child is not being able to receive, right? So something there which is not natural, right? Now, if it has come in 3 months, that means either it was born or along the way this has come about. Now, it was born with a defect, then it's going to be a problem because it's
Mm.
just 3 months. But if it was born okay, and then the defect came, then definitely you can see recovery.
Mm. Can we blow directly on tumors? Tumor.
That's what people are doing, right?
Okay. Yes.
They're not only on the tumors, around the tumors,
Around the
because
tumor. Mm.
around the tumors you have blood vessels which are not working very well and creating this tumor. So you want those vessels to be revived, recovered as well.
Mm. Wow. Amazing. Oh, systemic lupus. Systemic lupus erythematosus disease. Since the start of COVID, can they use IteraCare for systemic lupus erythematosus disease?
That's a big word.
Yeah.
So what exactly is happening to them? If I know exactly what's happening to the person, is it like the cells are attacking, the body is attacking the own cells? It couldn't identify which is good and which is bad, and so it's attacking. All right. So in this case, the immune system has gone haywire. When it goes
Mm,
haywire, it doesn't know how to identify which one is which. So you start working on your immune system, bring it back to what it should be, and then it starts identifying what is right and what is wrong.
that's right.
Yeah.
Can IteraCare help regrow cartilage?
Cartilage is something which is possible. Now,
Mm,
if I'm not wrong, most of the things in the body can be regrown. Maybe the bones may take little bit difficult, but take longer. The only thing which if it's gone, if it's torn, you have a problem is with your ligaments. All right,
mm,
ligaments definitely you have to go for surgery. Right. Beside the ligaments, you have the tendons, you have the cartilage. Normally, they are able to recover.
wow.
Now, coming back to the cartilage, I think I can sort of assume that it has to do with the knees, right? The bones which are together, some cartilage bones there, and they start pressing on each other, and then you have pain, and then synovial fluid which is inside may not be as much as it should be, so there's no cushion there, so the cartilage starts touching each other, and you have lots of pain. So then people want to find a cure for that. Now, if that is the case, now the vessels, the blood vessels which are around, not only that area but around there, probably is not bringing enough blood to those areas. So because of that, the cartilage doesn't work as it should. The synovial fluid is not working as it should, and then you have this problem. But when you start blowing, give yourself a little bit of time, and the synovial fluid starts getting better, the cartilage starts getting better, then the problem is resolved.
Wow, that is great. Now I have a few more, Mr. Soma. This is about a follow-up question by Carla. Endometriosis. Can IteraCare replace the surgery? Someone advised by her gynecologist for operation. Can it replace the surgery for the endometriosis?
Okay, the problem here is we do not know exactly what is the problem. I only explained one part of it by the fallopian tube and then the womb, right? So the environment must be clean where when the eggs and then the sperm comes in, they have a chance for survival, right? If it's not clean, then we cannot survive. So then now, what do you call that? If we know what is the problem, then there is a good chance we can tell the person what exactly. Okay, I see here there's a lump form. Now, when there's a lump, probably it's an inflammation or something which has gone wrong. So definitely you can blow, bring down that lump.
What about epilepsy? Can it be used epilepsy?
Epilepsy is another thing. Not everybody has, and it could be something where it came after birth. You have that, so that's going to be very difficult.
Very difficult for that. Okay.
Yes.
All right. Now we're going to end. It's already 5 minutes to midnight. I'm still enjoying it. I'm really still enjoying
Time
it.
just passed, huh? Flew by.
Time just passed. Amazing. Okay. So what I'll do is I'm going to save all these questions. And again, we're going to answer them as much as we can and post them. There in your group chat, you can see that my wife posted the link of the Facebook page. That is actually my Facebook page, but we're going to post it there for now. All right. And this is recorded. So we're going to try to post this also in YouTube so you can review them. So again, I hope you enjoy this night, ladies and gentlemen, with our time with Mr. Soma. This is just the beginning. Am I right, Mr. Soma? This is just the beginning.
We'll definitely have more sessions for people, who like to ask questions from time to time. And I think this is the best avenue for them to ask questions, because when they send by WhatsApp or they post it, sometimes it takes too long to reply. I mean, too much to write. And secondly, the message does not get across.
Correct.
Here, directly, physically, I mean, face to face, on Zoom, we can get the message across.
Correct. There's another suggestion here. Would it be useful to have an FAQ document? I think we have that already, right? Because you have a video, frequently asked questions. So can we have that in a written form?
I think there is. We have in written form. It's actually going the rounds. The ones which we did frequently asked questions, somebody has already put it in. My what do you call it? The thing is there. And it's going the rounds, and maybe I can pass it to you to be posted.
All right, thank you for that, Mr. Soma. Okay, there is already FAQ. It's written, and I'm gonna pass it again. I'm gonna send it to all our group chats. That's amazing. Wow. Now, guys, this is part of our part of our responsibility or goal, Mr. Soma. Remember that even the company will come up with a lot of materials which will be standardized. And of course, Mr. Soma is the head of that to make sure that once it's passed to the public, to the distributors, it's all like sorted out. It's all double checked. So that is the role of Mr. Soma, and that will be hopefully very soon. Okay. And regarding the FAQ document, Deborah, yes, it will be passed to me, and I'm going to pass it to all of you. All right. So I hope you had a great time. You're most welcome. Those of you saying thank you, most welcome. Now I'm going to ask you to unmute yourself so you can say thank you to Mr. Soma.
Mr. Nathan, one last note.
Yeah.
one last note.
Go ahead.
I know most people call me Dr. Soma, but I'm actually just Soma. I mean,
Yeah.
I would like to get that across because
Okay.
it's not a Dr. Soma. I'm not a doctor. I mean, that has to be addressed because it's only correct.
Yes, correct,
All
correct.
right.
Thank you for
So
that,
I
Mr.
know
Soma.
wherever I go, I end up being called Dr. Soma, and there are even some call me Professor Soma, and then I have to tell them that no, I'm just Soma.
Actually, you look like Mr. Gandhi.
Oh,
Yeah, right. You look like Mr. Gandhi. Can you agree with me, Naja? Naja, I can see you there.
Yes.
Looks like
yeah.
Mr. Gandhi and the X-Man Professor X,
Oh.
Xavier.
And one more thing, Mr. Nathan.
Yes, sir.
With the reason why I am here with this company and with this device is because it's helping tons of people and it's going to help lots more people. That's the only reason why I am with this company and no other company, and I do not want to do anything else because every time you use this device, you're helping someone, and it's just a feeling which is priceless. And I believe all of those who are here are feeling the same way. And it's blessings for your family, blessings for yourself, and blessings for everybody.
Wow. Thank you for that. I'm
Yeah.
so happy. Thank you for your time. I know, guys, you enjoyed it. Now, I got one request, okay, before we exit.